Hi friends, welcome to classes by Lab Doctor. In today's class, let us study how do we treat vitamin D deficiency. So vitamin D deficiency is very common and there are many causes for vitamin D deficiency, mainly because of our lifestyle. We see most of the patients having this vitamin D. We don't expose ourselves to sun. We are always indoors, working in the office, AC chambers, in front of the laptop, so we don't get enough of vitamin D sunlight. We don't consume healthy balanced food, and that is why there is deficiency of vitamin D. People who are staying in high latitude area, they have vitamin D deficiency. And whenever there is an excessive air pollution, or people who are dark skinned, they have a tendency to get vitamin D. And suppose if the patient is on certain medications like corticosteroids or anti-epileptic, they might develop vitamin D deficiency. If the patient is having liver failure, cirrhosis, alcoholism, etc., which will cause liver damage, that can cause a low vitamin D. If the patient is having kidney disease, chronic kidney disease, nephrotic syndrome, etc., then the patient can develop vitamin D deficiency. If the patient is very obese, then the patient can develop vitamin D deficiency, and vitamin D deficiency can lead to obesity. If there is any problem in the intestine, patient is having inflammatory bowel disease, patient is having Crohn's disease, ulcerative colitis, celiac disease, bariatric surgery, etc., all this will cause decreased absorption of vitamin D, nutritional deficiencies, and then patient can have low vitamin D. So to treat, when we talk about treating vitamin D deficiency, we will have to focus on many things, just not the sunlight or the diet. We have to look into many things. That is, first is we have to try and find out what is the cause, and also then we will have to combine it with your exposure to sunlight, proper food, and supplementation. And also remember, all the supplements have to be taken under the guidance of your doctor, because sometimes people keep on taking the vitamins over the counter for prolonged period of time, and they will land up in some other kind of a complications. So sunlight exposure is the cheapest and best way of getting vitamin D. It is a natural source, and we have already discussed about how much we should get exposed to sunlight to get vitamin D. So minimum at around 10 to 30 minutes if you spend, and at least some 3 to 4 times a week to sunlight between 10 a.m. to 3 p.m., that would be sufficient to maintain your vitamin D level. And what kind of clothing to be worn, what part of your body should be exposed, everything we have discussed in the previous videos. You can refer that. But yes, sunlight is the cheapest and the best source of vitamin D. It doesn't just make you your vitamin D levels go up, but also it will improve your mood, it will improve your overall health, it will improve your skin, it will improve your hair, etc. So try to get sunlight. Best time would be between 10 a.m. to 3 p.m. At least some 10 to 30 minutes of sun exposure, and at least 3 to 4 times a week, that would be better. Yes, it depends on various factors, how much sun exposure, or how much sun light you are getting in your geographic area, what is your skin tone, etc., etc. But yes, sun exposure is one way of getting a vitamin D. And we have told you what are the requirements of vitamin D. So it is usually between 600 to 800 international units. As we age, the requirement increases. And one of the sources of vitamin D is your food. So food rich in vitamin D also has to be consumed. You just cannot keep on taking the supplements. So food rich in vitamin D would be your fishes, your fatty fishes, salmon, tuna, etc. Your dairy products, so your paneer, your milk, curd, cheese, butter, these are rich in vitamin D. And your ghee, suppose your egg, that is also, egg yolk is having enough and more of vitamin D. And for the vegetarians, the sources of vitamin D are less, but they can take this mushrooms. The UV exposed mushrooms are a good source. your your cod liver oil or fish liver oil, they also contain your wet vitamin D. Vegetables like peas, your spinach, your okra, they contain vitamin D. Beef liver, pork liver, they have your pork liver that has vitamin D. So all these are the sources, food sources of vitamin D, that also we have discussed in our previous videos. So refer to that also. And next would be vitamin D supplements. Vitamin D supplements, when we cannot get enough of vitamin D from the sun or from the food, we will have to supplement with vitamin D. Vitamin D supplements are available in the form of capsules, and in the form of sachets, and in the form of injection, in the form of liquid shots. So these are the capsules. You can see around 60,000 international units soft gel capsules. Similarly, you can see here, and then you get this sachets also, which have 60,000 international units of sachets and granules. You get even injection, 6 lakhs, 3 lakh unit of injection. If there is severe deficiency, we even give them injections. So vitamin D injections are available. Vitamin D nano shots, liquid shots are available. They have these nano granules which will help in the absorption very soon. So even these are available. So these are the different supplement forms which we see: soft gel capsules, sachet, injection, and your nano shots, liquid shots. And remember, this vitamin D is a fat soluble vitamin. ठीक है, तो ये फैट में soluble होता है. So whenever you are taking vitamin D, आपको you should always take it after breakfast or after lunch, जब आपका खाने में थोड़ा फैट रहता है. That is the time. So you should better take it in the either after breakfast or after lunch, and take it with some kind of a fatty food. You can take it with milk, you can take it with curd, you can take it with buttermilk. So that would increase the absorption of this vitamin D. And whenever there is a deficiency, we categorize it as mild, moderate, and severe. Mild is when the deficiency is between 20 to 30 nanogram per ml, and severe is when the deficiency is less than 10 nanogram per ml. So if there is a mild deficiency, if the patient is having up to 30 nanogram per ml, the dosage would be around 8 doses of vitamin D we ask the patient to take. So we will break it into 6 weeks continuously. The patient has to take it. So suppose if the patient has taken on Monday, next Monday he will take another dose. So like that he has to take one dose every week for 6 weeks. So that became how many doses? 6 doses. And the next 4 weeks he will take alternate weeks. So for 15 days he will take one dose. So 6 weeks continuously, 4 weeks alternating. So that is 6 plus 2, that is 8 doses. So patient will take 8 doses. So then this vitamin D, we might have to again give them a maintenance dose of 1 dose per month. But usually if there is a mild deficiency, these 8 doses would be sufficient. So in moderate deficiency, patient has around 10 to 20 nanogram per ml. So the level is still less here compared to the mild deficiency. So we will have to give little more dose. So here we give up to 10 dose. So how we give 10 dose? 8 weeks we give them continuously. So Monday he takes, next Monday he takes. So like this he takes this dose continuously every Monday for 8 weeks. And then the next 4 weeks he will take alternating dose, that is 8 plus 2, that is 10 doses, and then we put him on a मेंटेनेंस डोज. सो अगर पेशेंट को मॉडरेट डेफिशिएंसी है, समझिए आपका विटामिन डी 10 to 20 नैनोग्राम पर एमएल में आ गया, तो हम उस पेशेंट को एक 10 डोजेस देते हैं विटामिन डी का, वो सैशे हो या आपका जो कैप्सूल्स हो, वो जो भी हो, 60,000 इंटरनेशनल यूनिट्स का. तो हम क्या बोलते हैं उसको, वीकली मंडे, हर मंडे उसको एक 60,000 इंटरनेशनल यूनिट्स का उसको विटामिन डी लेना है. तो ऐसे उसको कंटिन्यूअसली 8 हफ्ते लेना है. तो उसने 8 डोजेज ले लिया. फिर नेक्स्ट जो डोसेज रहेंगे 4 वीक्स का है, उसमें वो अल्टरनेटिंग वीक्स में लेगा, मतलब 9th he will take, the next Monday he will not take, and the third Monday he will take. So totally he will take 8 plus 2 doses, वो 10 डोज ले लेगा. उसके बाद में we put him on a maintenance dose. एक महीने में एक डोज देंगे, वो मेंटेनेंस डोज है टू मेंटेन द विटामिन डी, क्योंकि व्हेन यू टेक विटामिन डी एंड अगर आप छोड़ दोगे फिर उसका लेवल कम हो जाएगा बिकॉज ऑफ दैट. And suppose if the patient is having severe deficiency, that means the value is less than 10 nanogram per ml, we really need to improve his vitamin D, because this is very critical. So sometimes we even give the patients injections also. I told you 3 lakhs 6 lakhs injections also are available to increase the level. Very soon we even give them intramuscular injections of vitamin D. Otherwise, if you are giving oral dosage, that will be for total 12 dosages. That means 10 weeks he will have to take continuously. 10 doses he has to take, every week 1 dose. So that will be for 10 weeks, and the next 4 weeks he will take alternating doses. So that is 10 plus 2, that will be 12 doses. So in mild deficiency it was around 8 doses, moderate deficiency it became 10 doses, and in severe deficiency it became 12 doses. But there are various factors which influence the dosage. कितना देना है, कब तक देना है, सिर्फ हर पेशेंट को एक ही नहीं रहता है, बहुत फैक्टर्स उसको इन्फ्लुएंस करते रहते हैं. लाइक हाउ सिवियर इट इज, कितना सीवियर है डेफिशिएंसी, माइल्ड है, मॉडरेट है, सीवियर है, 8 डोजेस देना है, 10 देना है, 12 डोजेस देना है. सो इट डिपेंड्स अपॉन द सीवियरिटी ऑफ द डेफिशिएंसी. व्हाट इज द अंडरलाइंग हेल्थ कंडीशन, पेशेंट को क्या है, माल एब्जॉर्प्शन सिंड्रोम है, किडनी डिसीज है, और ही इज ऑन अदर मेडिकेशंस फॉर दिस विटामिन डी. सो दैट also will matter. How is the dietary habit of that patient, whether he is able to take vitamin D rich food, or he might require regular injection, regular dosing, etc. How much is the sun exposure of that person, whether the person is living in the higher latitude, whether that person is spending most of the time indoor. All this will decide how much dosage and frequency we have to take and give it to the patient. So this was in brief or in general what I have told you, that whenever there is deficiency, yes, हम लोग patient को बोलते हैं lifestyle थोड़ा change करो, sunlight में जाओ, and have food which is things which are rich in vitamin D. And also if we have to supplement the patients if the deficiency is very bad, because vitamin D is a very important hormone. It is just not for your bone or just not for your muscle. For every cell in your body will require vitamin D, from your immunity, your heart, your teeth, your brain, your skin, your hair, everything requires vitamin D. So please get your vitamin D checked. I have also done a video on vitamin D blood test. And if there is a deficiency, discuss with your doctor, improve your lifestyle, get yourself some sunlight, make changes in your diet, get some exercise and sunshine. And also you will have to take certain supplements when we cannot meet the requirement of your vitamin D through your sun exposure or through diet. Okay, so that was all about the vitamin D deficiency treatments. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.